April 2024 marks a significant milestone as South Africa celebrates 30 years of democracy and the Gauteng Provincial Legislature's existence. In 1994, legislatures were established to make laws for provinces and hold provincial governments accountable for service delivery and the use of public funds. Committees of the legislature consider laws, monitor the work of provincial government departments, and make recommendations about the work of departments, including their structure, functioning, and policies. Meet the chairpersons.
In conversation with the chairperson of Health and Wellness Portfolio Committee, Advocate Ezra Letsoalo. Let's appreciate the time you're giving us, and we're grateful that you've taken this moment to speak to us. The end of the first quarter saw a consideration of the department's first quarter performance report for the 2024-2025 financial year. Would you say the report shows sufficient progress towards implementation of planned programs by the Department of Health?
In some respects, it does, and simply because the Department of Health has got a lot of moving pieces. It's a complex department with a number of programs, core dependencies. And so my viewpoint is that, the department is steadily on the right track.
Would you say there's an alignment between the department's financial performance and its priorities?
It's look, my reading into it is that there is, because there are instances where there's overspending, which can be justified. Okay. If there's overspending on administration, this is essentially related to the workforce of the department. The department sees quite a number of assimilation of personnel across the board. So it could be at a level of a clinic, could be at a level of hospital, even internal, And so it's almost continuous. So there's never really a point where you can say the department must pause in assimilating personnel. And so if you look at the report, it speaks about overspending.
Yes.
And I know somebody might easily assume that, overspending, it means, the financial controls of the department are skewed. But that may not necessarily be the case.
Okay.
Because essentially the department responds to the rising demand for health services. And as it does that, often at times what might be budgeted for as against the realities of the day might be two different, realities. And so where was in this overspending, so long as it can be justified logically, I think we would say there's a greater alignment. Of course, there are instances where there might be underspending, and you begin to worry, because underspending in the health sector, raises the flags. But that too, when you probe deeper, you find that often at times the department could not spend on specific programs because of complexities related to either procurement of goods and services. Because ordinarily, we usually encourage the department to procure from township enterprises, and you will find that most people will not have a complete, and requisite, documentation and all of that, and therefore it delays the procurement processes of the department, and that is why you are likely to see underspending in some respects. But over and above, if you look at the overall spend by the department, it's standing at about 98.1.
Yeah.
So you see, it's acceptable according to Treasury, norms, as well as the AG, standards. So I think even as the committee have passed it through.
And please correct me if I'm wrong. I sort of skimmed through the report, and I thought the underlying theme seems to suggest, that the financial health of the department is in a poor state. Key words like projected over expenditure of 135.4%, underspending in key areas like 96.1% in general hospital services. The challenge here, what is it? Is it personnel? Is it skill? Is it financial controls?
Look, I think maybe the writing styles of some of these reports sort of gives an impression that, there's a glue.
Okay.
But it may not necessarily be the case. So you then have got to interpret, rationalize the reports, because we make observations as the committee. And of course, we will have concerns about whether budgetary spend on specific programs matches up with, outputs. And if to some extent, even to the slightest extent, and remember the sensibility around the health sector is that you don't shop around for health. So any variable that goes into health might be a cause for concern. So if there's a R1 that needed to be spent, but wasn't spent, I mean, it still raises flags, because we wonder whether that could not have gone towards the purchase of a cotton.
Yeah.
Because there might be additional personnel or people, coming through our province. And of course, our province has got that kind of a challenge, where you are seeing an inward migration, and it happens. I mean, this is a daily activity. So if you were to ask me, what are some of the overarching issues that we may be personally concerned about, it's how to, overall professionalize the system, across the spectrum. So you need capable, credible financial managers, and they are there, but maybe elevate them through. We usually maintain that the continuous professional development programs, because no one working terrain remains the same for them.
Sure.
So people must adapt and acclimatize to newer practices. So we've seen that as an overarching issue. Of course, there is a remedial plan which the department will have communicated. Wire to see how that is, actualized. But the other reality that needs to be appreciated, it's the limitation of the budget itself. So we lament the fact that the department can't cover up everything. But when you have regard to the budgetary envelope of the department, I mean, they allocated no more than 64 billion. And then the bulk of the 60 billion goes towards payment of salaries. Like I said earlier, on the clinics, hospitals, the department, different offices, all of those things, including goods and services. So it almost accounts for a greater portion of the budget. So you no longer now have the 64 billion. And as if that was not enough, but you also have to contend with accruals from a previous financial years, where there might have been a commitment to pay off medical legal claims. And the department does really try, to assuage, to dissuade them rather, the ever rising bill as it relates to medical, legal cases. So if you will, my other view is that you need an increment, you need an expansive budget if you are ever going to be decisively responsive to the growing health and demand in the province. But I think simply there's a number of variables that has got to be looked into to sort of build up the necessary system efficiencies.
And then, you mentioned doom and gloom. Seemingly, according to the report, it's not all doom and gloom. I mean, the department has managed to reduce maternal deaths by 79%, and diarrhea case fatality rates below targets. 62.5% of children received vitamin A. So this is good news. I mean, I'm sure this can be sustained.
Sure. No, definitely. And these are some of the things that we would usually commend the department on. But we're not only commending because it appears in a report for a specific court. We are commending such that there's a level of, sustainability around those. Also, you want to see the reading line remaining constant, so that there's no, decline. And there are those instances where the department, does quite well, and ordinarily would commend them. Of course, like I would have earlier stated, there are instances where we're also concerned, about the decline of a specific, health provisioning.
I'm aware that the committee also did an oversight visit in Ekurhuleni. What was the committee's assessment of facilities and commitment to address any challenges that you may have found?
So we visited about 3 community health centers. So these are different from your local clinics. In fact, some of our communities regard to them as mini, medical centers or mini hospitals, if you will, because they've got a bit of an expansive range of services which are provided for. And then we really went there to assess their overall functionality. And of course, the health sector is, largely regulated. So there's a number of, prescripts, from what should be in a clinic, an ideal clinic. There are specific, inputs that should be there. Whether it's a stethoscope, essential, a drug list, essential equipment list, whether there's a functionality within a maternal wards and they've got all the equipments, whether there's a presence of a doctors, whether there's security, because you also, have got to consider patient safety. But the overall, dwellings of the facility itself, whether it's one that lends itself into appealability, and user-friendliness. And so essentially that is what we had gone there to assess. Of course, the clinics are in different locations within the district of Ekurhuleni. And we made a number of observations. In other instances, what we picked up is that there's an inadequacy of a space, for certain health services to be carried effectively, because the space accounts for a number of challenges that have been observed by those facilities. But like I said, overall, it was just there to assess the functionality of the clinics.
And we all appreciate, the provincial legislature, the role it plays in terms of lawmaking. Are there any bills that you're currently looking at as a committee, with the priorities of, improving the lives of the people of Gauteng?
Not as yet, because like I would usually maintain, health, it's quite a unique terrain, and if you will, central coordination of health programs originates from national. We have justice in national, or the president rather, has sent into the National Health Insurance Act. And we're steadily wondering what the regulatory framework of that would be, even before we can rush ourselves, from coming up with any concomitant, frameworks. So we're still assessing that, but we're also freshly a new committee. We're still inducting members who are coming into the legislature anew, including even on the process of legislation drafting. So not for now, but I suppose in the pipeline, just to reinforce how the actualization of the national health insurance.
Advocate Letsoalo, would you say that the Department of Health is aligned with the various commitments that were made by Premier Lesufi in his State of the Province address on the 15th of August, 2024?
It is in the greatest of respects, because from what we are made to be aware of is that ordinarily the Premier consults first with his executive authorities. So I doubt if the Premier would communicate something that is misaligned to what the departmental priorities would be, because there's a planning process even prior, the hosting of the State of the Province address. So much of what is coming out of the State of the Province would emanate from deliberations and consultations with relevant health stakeholders, including ourselves in the committee, in the legislature as well.
And just in closing, I know you mentioned that it's early days, but when you look ahead, what sort of legacy would you like to leave as a chairperson of this committee in terms of accountability, governance, and the main thing, which is improving the lives of the people of Gauteng?
Well, I'll tell you, one of the focal points is really just about having a conversation on having an expanded budgetary reach.
Okay.
because it is the sum total of whether the department would have the ability to respond to the growing health needs amongst the residents who offer the province. Minus that, you are less likely not to achieve anything. But secondly, it's a building system efficiencies in the manner and style in how the department gets to be accountable to the residents of Gauteng, you know. And that could be, expressed to different forms. One of them, the building up or strengthening existing mechanisms for complaints, which users of different health facilities would have. And I was arguing earlier on in the meeting that that you need to have a system interoperability between the legislature and the department, where almost immediately, when somebody raises a concern about a facility, the legislature can pick it up and almost immediately be able to follow up with the department and for it to be remedied. And I think that will go a long way in building the right kind of confidence in the use of our systems. But of course, there's a range of other things, and amongst those is the overall patient satisfaction. So the Department of Health has got what they refer to as a patient satisfaction surveys, which they do. Of course, it's only annual. But we thought in the legislature, we need to devise a mechanism so that we can test the functionality and the satisfaction of end users of these facilities against our own systems. So it's something that we also want to explore, similar to how we'll have done it with the petitions, committee. Have a real time, a mechanism that would enable to have people as concerns or grievances being heard. So I think amongst what we deem to be our legacies, because it's not an individual legacy, it's a committee legacy, because I'm not sitting alone in shock. I'm sitting with the other members, and I suppose they too might have their own issues. But I think as a start, we've agreed on those three. That if we can achieve this within a short space of time, it's going to assist the overall oversight function of the legislature over the department.
The chairperson of the Health and Wellness Portfolio Committee, Advocate Ezra Letsoalo, we wish you and your committee good health, and we wish the department good work in progress along with the people of Gauteng. Thank you so much.
Thank you. Sure.
Right.